So the way I respond to physicians that discuss biomarkers not being in guidelines is the fact that guidelines, by and large, by the time they are written, are already outdated. It's important to understand that our field, when it comes to diagnosing and managing lung nodules, is evolving faster than we've ever seen in the past. There's been an exponential growth in technology, in imaging, in understanding biopsies and understanding these techniques, that it's important to make sure that we are offering and validating all of the tools at our disposal. Notify has been done by thousands of physicians across the country. It's been done tens of thousands of times everywhere across the US. It is something that it has become a standard on how we manage these patients with lung nodules. And by doing it, you have nothing to lose and everything to gain. It's something that you can validate on your own and see what we've all seen on the power and the helpfulness and what it brings to us as an added tool in our toolbox to help make these decisions correctly, above and beyond what a guideline says.
So to somebody who is concerned about the guidelines related to Biodesix testing, my response is guidelines are usually outdated by the time they're released, that oftentimes when they are released, they don't take into context the most recent publications that could be groundbreaking, and that they're not updated enough for us to really hang our hat on. Best example is, for neurocritical care, you have traumatic brain injury guidelines. It took them 15 years to update. The amount of things that were available and were being practiced had nothing to do with the guidelines at that point. So how do we use guidelines as clinicians? It is just generally a framework of, where's the bathroom? Oh, it's over there. Okay, I'm going to go that direction. But you have to use evidence-based medicine. You have to use new tools. You have to, keep your eyes open so that you can actually find the bathroom, right? And so having a more detailed plan of practice is always best. So it's a question of, do you practice according to the guidelines or do you practice according to evidence-based medicine? And I think I wouldn't be alone in the majority of people that say the best practice is evidence-based medicine, not guideline medicine, okay? And so guidelines are just a way for us to know that we're in the right spectrum. How do we do this? And if we look at the guidelines, the indeterminate, for example, it used to be you can do anything, and you still can. CHEST has kind of made it, well, maybe we should do one or the other here, biopsy or do a PET scan. But those are revisions, and we kind of already knew that a decade ago. So if you were following the guidelines, if you had an indeterminate, you were sending people for lung resection according to what the guidelines said was okay to do. And so was that the right choice? No. You use common sense, use evidence-based practice. And so give it some time. Hopefully it'll make the guidelines here soon.